interventions. These are strategies that are evidence-based that essentially take strategies that would have been just used in schools and encourage it to be embedded into the natural environment of the child. So what Ms. Sinnaman is doing is essentially using proven strategies and helping parents to see how they can use it, deploy it in their natural setting. For example, they used to have the picture exchange. These are things that have evidence for it. People use them in schools, but the reality is that the child is not going to stay in school 24/7. The child is going to come back home. So how can a parent embed this into their home?
Child A on the spectrum is different from child B. And I'm talking from speech angle now. Child A might be non-verbal autistic child. Child B might be verbal autistic child. Child A can be non-verbal autistic child with behavioral issues. That is, having hypersensitivity to sound, to light, to this, to that. And child B, that is verbal autistic child, not having any behavioral issue, or it's just on the spectrum. So you cannot use same strategy. You have to determine the needs of your child. And when you are determining the needs of your child, you have to look at it in like 6 domains. Domains of speech. Domains of speech, that is the pragmatic communication, social communication context. You can call it pragmatics, you can call it social communication domain. And the domain of adaptive, domains of fine motor, domains of gross motor, domains of cognitive abilities, that we know as literacy, numeracy, scholastic abilities. And when we are talking about cognitive abilities, it is not about what the child is going to learn at school alone. Learning takes place in the house. For the fact that your child is on the spectrum or child is having neurodevelopmental issues, that doesn't mean you should neglect the child. That doesn't mean you should not incorporate the child into the needs in the family.